10 Steps to a Healthy Pregnancy. Adequate nutrition. A healthy diet is essential for the development and growth of the fetus. Tissue and organ development, including the brain, are aided by eating protein-rich foods like soy, meat, and seafood. Foods rich in folic acid, like avocados, liver, eggs, spinach, peas, and many others, can help protect unborn babies from brain and spine defects known as neural tube defects. A healthy amount of carbohydrates in your diet will provide you with the energy you need throughout your pregnancy. Some examples of foods that fit into this category are rice, whole grain bread, potatoes, yam cereals, and more. At this time, it is very important to consume foods rich in calcium, vitamins, and iron to ensure optimal bone and immune system development, optimal fetal growth, and optimal blood volume and oxygen delivery. Brain health depends on the omega-3 fatty acids found in seafood like mackerel, oysters, salmon, and sardines. Getting enough physical exercise. Exercises like brisk walking, swimming, dancing, stair climbing, and yoga are important to engage in because they not only help improve stamina, but also have a refreshing way of improving mood, fighting fatigue, and relieving constipation. Kegel exercises are recommended before, during, and after pregnancy because of their positive effects on the health of the pelvic organs. Remember your health history, stay away from anything too strenuous, and consult your caregiver to find the best exercises for you before beginning any of these. Good rest. A good night's sleep can do wonders for your state of mind, energy level, immune system, and memory, as well as help prevent hypertension, preeclampsia, and other risks to you and your unborn child during pregnancy. Although rest and sleep can be negatively affected by anxiety, insomnia, and body pain, it is important to think about the little pumpkin in your belly and find a way to have at least 8 hours of sleep every night. Having sex. You don't have to worry about harming your unborn child if you and your partner engage in sexual activity while you're pregnant. An increase in blood flow during sex orgasm has been linked to reduced blood pressure, increased intimacy, and a more stable state of mind. Talk to your doctor if you have a history of miscarriage, placenta previa, bleeding, or an incompetent cervix, or if you are at high risk for these complications. Drinking of water. Avoiding common pregnancy-related issues like hemorrhoids, constipation, headaches, fatigue, and oligohydramnios can be as simple as drinking plenty of water. The recommended daily intake of water is between 8 and 12 glasses. Avoid engaging in unhealthy behaviors like smoking and excessive alcohol consumption. Adopting an unhealthy lifestyle during pregnancy is not only dangerous but also unacceptable. Smoking and alcohol consumption raises the risk of fetal alcohol syndrome, low birth weight, sudden infant death syndrome, premature labor, and respiratory problems. Don't take lightly the importance of your prenatal care visit. After a positive pregnancy test, it's crucial to schedule and keep all of your prenatal appointments so that your doctor can get a complete view of your health, learn what they can do to best support you and your baby, and spot any problems early on so that they can be addressed and avoided. Not only can you learn more about your condition, but you can also ask any questions you have. So, whether or not you're in good health, you must comply with all of your prenatal doctor visits, shots, and medications as prescribed. Acquaint yourself with your rhesus status. If you are rhesus positive and expecting a rhesus negative child or vice versa, you must understand how the rhesus factor works, as your body will react by producing antibodies when the blood mixes, resulting in rhesus sensitization. Most often, this occurs in subsequent pregnancies. Antibodies in your body attack the fetus red blood cells, putting the fetus in grave danger. If you or your partner is rhesus positive and your partner is rhesus negative, you should discuss this with your caregiver. Keep track of your baby's movement. Once quickening has been established, you should pay close attention to your baby's movement, which may take the form of a flutter, kick, or roll depending on your baby. However, you should notify your caregiver right away if you notice a change in your baby's movement that is out of the ordinary. Do not attempt to self-medicate without consulting your caregiver. In other words, you shouldn't attempt this. Because of the risk of fetal abnormalities, fetal death, and chromosomal changes, it is unsafe for both the mother and her unborn child. You're welcome for watching. Be sure to subscribe for more videos like this one if you found it entertaining.